The impacts of long-term alcohol consumption on health are largely negative, dependent on the quantity of ethanol ingested. Even occasional light drinking can carry health risks, although minor benefits have been linked with moderate quantities of alcohol-intensive chronic drinking, however, inflicts serious harm on health, surpassing any potential benefits it may offer. Long-standing alcohol usage can impair almost every organ and bodily system. Some of the risks include various fatal diseases like malnutrition, chronic pancreatitis, heart diseases, several types of cancer, and even particular types of dementia. Long-term heavy alcohol usage can induce damage to both the central and peripheral nervous system, and enhanced risk of accidental injuries, such as in traffic accidents and falls, is also associated with heavy drinking. Exorbitant alcohol consumption can also negatively affect the aging process. The brains of adolescents and fetuses stand extremely vulnerable to alcohol's harmful effect. Societies worldwide have brought about alcohol packaging warning labels to educate consumers about alcohol's potential dangers. Despite its risks, light alcohol consumption might carry certain benefits, such as reduced cardiovascular risk, diminished risk of type 2 diabetes, and lessened chances of gastritis and cholestasis. Similarly, alcohol consumption might bring about certain psychosocial benefits like stress reduction and mood elevation, however. Whether these benefits outweigh cancer risks associated with alcohol remains arguable. The optimal level of alcohol consumption that mitigates the risk of disease, injury, and death remains a contentious subject. Some studies propose minimal consumption rather than total abstinence, while others tout complete abstention from alcohol as the best strategy nonetheless. These studies are incomparable due to their utilization of different databases and methodologies. Furthermore, categorizing occasional and former drinkers as abstainers in some studies conceals the benefits of lifelong abstinence, as former drinkers typically possess poor health despite this. Several studies reiterate the merits of minimal alcohol consumption after considering these confounders. Early studies on hormone replacement therapy, HERA, vitamin A and B carotene medication yielded evidence that these treatments could be effective in targeting certain health conditions. However, subsequent randomized trials couldn't replicate these effects for heart. A comprehensive analysis of multiple randomized controlled trials, ERCs, indicated that the therapy's benefits mainly applied to women undergoing the menopausal transition. Similarly, vitamin E benefits appeared prevalent only among certain demographics, such as diabetics and those with specific genotypes. On the other hand, B-carotene increased the risk of cardiovascular disease, with any beneficial effects attributable to other vitamins in foods that contain B-carotene. The promotion of alcohol as beneficial for health has been met with heavy criticism, with a World Health Organization physician describing such promotion as reckless and hazardous. It's argued that alcohol's health benefits are, at best, contentious. A narrative possibly inflated by the alcohol industry. Some medical practitioners even propose considering alcohol as a recreational drug with serious health repercussions. Instead, regular exercise and a balanced diet seem to be more effective means of combating cardiovascular diseases. Statistical data in recent studies underscore alcohol consumption at damaging levels. If the various health risks associated with alcohol were depicted on a J-curve, then a daily intake of 5 grams of ethanol would denote a minimal level of risk. Consuming more than 17 grams per day, however, would be considered harmful in 2020. 1.78 million deaths were attributed to alcohol use, particularly amongst men aged 15-49. Alcohol was the leading cause of death. Approximately 1.3 billion men and 312 million women consumed harmful amounts of alcohol. Over the last 3 decades, the proportion of the population consuming harmful levels of alcohol hasn't significantly reduced, with the highest risk prevalent amongst 15-39-year-olds due to binge drinking practices leading often to violence or accidents. Given the international repercussions of alcohol misuse, the World Health Organization has stressed the necessity of reassessing alcohol control policies to reduce overall consumption. Contrarily, considerable research in Western societies has consistently linked increased survival rates to light to moderate alcohol consumption. Still, cultures outside of the West show different trends, with the Inner Heart study underscoring that alcohol did not protect South Asians against coronary artery disease, CAD, as it did in other populations. In fact, Asian Indians who consumed alcohol had a 60 higher risk of heart attacks, a risk that spiked to 80 with local spirits compared to 50 with branded spirits. This increased risk applied to occasional and regular light, moderate, and heavy drinkers. A comparative study in India also concluded that alcohol might increase the risk of coronary disease in men. Against their lifetime abstaining counterparts, alcohol users exhibited higher blood sugar, higher blood pressure levels, and significantly higher tobacco use. A UK governmental report affirms that while alcohol-linked deaths, 8,724, showed a dip in 2007 compared to 2006, it represented a significant increase from the 4,144 recorded in 1991. Further computations reveal a dramatic increase in the alcohol-related death rate per 100,000 of the population, standing at 133 in 2007, in contrast to 6.9 in 1991. Scotland experienced a direct health impact. In 2003, 1 in every 20 deaths was linked to alcohol, according to the ALCUS. In a sobering 2009 account, death rates from alcohol-related diseases tripled over the past 25 years, standing at 9,000. The UK study highlighted that the repercussions of low to moderate alcohol consumption on mortality are age-specific. The risk of death for ages 16-34 amplified due to a surge in cancer incidents, accidents, liver disease, while for individuals aged 55 and above, the risk of death dropped due to reduced occurrence of ischemic heart disease. A comprehensive British study unveils that around 4 of cancer cases nationally, amounting to 12,500 cases annually, are instigated by alcohol. In parallel, an alarming report from the Centers for Disease Control and Prevention, CDC, reveals that between 2001-2005, an estimated 79,000 deaths annually were alcohol-related, making it the third leading lifestyle-related cause of death in the U.S. each year. However, a slight silver lining is found. Alcohol has anticoagulant properties. Consequently, moderate alcohol consumers experience lower thrombosis rates compared to those who abstain. Meta-analyses of randomized trials show that moderate drinking decreases fibrinogen levels, a clot-forming protein, and increases levels of an enzyme that helps dissolve clots. Consequently, this leads to a near 24-fold decrease in the risk of coronary heart disease. Furthermore, moderate alcohol consumption has been linked to favorable changes in HDL cholesterol, adiponectin, and fibrinogen. However, a systematic review involving 16,351 participants traced a J-curve outlining the relationship between cardiovascular mortality and alcohol intake. The study demonstrated a protective effect with 5 of daily alcohol consumption, with significant effects noticeable up to 26 days. Interestingly, moderate drinkers display lower serum levels of C-reactive protein, CRB, a predictor of HD risk and marker of inflammation, than abstainers, implying that moderate alcohol usage could have anti-inflammatory effect. A particular study suggests that for men with initially low alcohol consumption, a subsequent cautious increase may decrease their cardiovascular disease risk. This study centers on the contrasting effects of alcohol consumption, specifically investigating its potential benefits when consumed moderately while examining the pronounced risks that coincide with high levels of intake. It highlights evidence suggesting that a moderate intake of alcohol, 1 to 2 drinks per day for men and 0.5 to 1 drink per day for women, could possibly offer protection against conditions like intermittent claudication and may improve survival rates post-heart attack. However, researchers emphasize a lack of randomized trials backing these claims. Conversely, the risks of excessive alcohol consumption are evident, increasing chances of heart failure, hypertriglyceridemia, cardiomyopathy, hypertension, and stroke, particularly when individuals consume 3 or more standard drinks per day. Long-term heavy drinking can lead to grave conditions such as alcoholic cardiomyopathy, resembling idiopathic dilated cardiomyopathy, and may eventually cause congestive heart failure. It can also result in abnormalities like anemia, thrombocytopenia, atrial fibrillation, and impaired brain development. Furthermore, chronic alcohol intake may distort brain chemistry, leading to conditions like alcohol dementia, brain shrinkage, physical dependence, alcoholic polyneuropathy, alcohol legs, amplified neuropsychiatric and cognitive disorders, along with memory and learning disruptions. While there is inconclusive evidence linking moderate alcohol consumption to an increased or decreased risk of dementia, some research suggests even moderate consumption may exacerbate brain volume loss. Likewise, chronic alcohol intake may increase levels of harmful amino acids like homocysteine, potentially contributing to conditions like alcohol withdrawal seizures, alcohol-induced brain atrophy, and cognitive disturbances. The study concludes with a call for more comprehensive research to draw definitive conclusions regarding the impact of alcohol on the human body and brain. The story focuses on the detrimental effects of chronic alcohol misuse on the brain. Consuming copious amounts of alcohol, especially over a prolonged period, doesn't just have harmful direct effects on the brain. It also contributes to conditions such as alcohol withdrawal, nutritional deficiencies, electrolyte imbalances, and liver damage, all of which negatively impact the brain. Chronically high levels of alcohol intake distort cognitive functions, resulting in individuals forgetting to perform crucial tasks at a predetermined future point, like locking doors or mailing letters. In the U.S., around 1/5 of mental health facility admissions are due to alcohol-induced cognitive impairment, primarily alcohol-related dementia. Chronic excessive drinking also leads to serious cognitive decline and various neuropsychiatric complications. The elderly are particularly susceptible to alcohol's brain-damaging effects. While there's some disputed evidence claiming that moderate alcohol consumption in early adulthood might protect against cognitive decline and dementia later in life, a study has opposed this view. Wernicke-Korsakoff syndrome, primarily resulting from thiamine deficiency and often associated with alcohol misuse, manifests as a combination of two disorders, Korsakoff's psychosis and Wernicke's encephalopathy. The latter is an acute presentation of the syndrome, characterized by a confusional state, while the former mainly causes memory and executive dysfunctions. Banana bags, or intravenous fluid containers filled with vitamins and minerals, can be employed to temper these consequences. Interestingly, essential tremors, especially those with a familial background, can be briefly alleviated in about 2/3 of patients by consuming small doses of alcohol. Ethanol, the main ingredient in alcohol, initiates a specific biochemical reaction implicated in essential tremor pathology. This biological mechanism could explain alcohol's beneficial effect. Chronic alcohol misuse can disrupt sleep, cause insomnia, and trigger disturbances such as frequent waking due to headaches and heavy sweating. Chronic alcohol abuse is also linked to certain sleep disorders and suppression of REM sleep. Cessation of chronic alcohol abuse can lead to exacerbated REM sleep as part of a rebound effect. Alcohol and substance dependence are strongly linked to a heightened risk of harmful actions, including suicide attempts, self-harm, and suicidal thoughts. This is particularly true for those who have been hospitalized due to such substance abuses. Other illegal drug usage accentuates this danger, with around 1/3 of suicides among under 35-year-olds associated with alcohol or drug misuse. Alcoholism detrimentally influences an individual's social skills due to alcohol's counteractive effects on the brain, particularly on the prefrontal cortex. Deficits in recognizing facial emotions, meaningful language interpretation, humor understanding, and social cognition in general are common symptoms seen in alcohol-dependent individuals. Research informs us that cravings and irritability are directly proportional to alcohol dependence. Furthermore, alcohol interventions have been found to be contributing factors to antisocial behavior in children, with common disorders reported by alcoholics being depression, anxiety, and panic disorder. This substance works to suppress activation within brain networks responsible for emotional processing, like the amygdala and hippocampus. Alcohol-induced mental health issues, as a result of neurochemical distortions in the brain, often show improvements or disappear altogether after sustained abstinence. However, initial withdrawal and recovery periods may accentuate such problems. Alcohol misuse, especially chronic, is a significant precursor to psychosis relative to other substances. This misuse is associated with an 800 rise in psychotic disorders in men and a 300 increase in women. These risks surpass those linked to cannabis use. In fact, about 3 of individuals reliant on alcohol are likely to experience psychosis during intoxication or withdrawal phases. The potential for alcohol-related psychosis can be attributed to neural membrane distortions, changes in gene expression, and thiamine deficiency. In certain cases, chronic and excessive alcohol usage may result in a persistent substance-induced psychotic disorder, such as schizophrenia. The repercussions of such a psychosis include increased susceptibility to depression and suicide, along with significant social impairments. Nevertheless, moderate wine consumption has been linked to a lesser risk of depression. Alcohol addiction not only brings about physiological changes, but it can also aggravate pre-existing conditions like depression, leading to a faster relapse. Alcohol dependence halves the effectiveness of existing therapies and medication as it alters the goal tone in the nucleus accumbens, leading to drug-seeking behavior. To overcome this, scientists propose using drugs like N-acetylcysteine that can regulate the glutamate system, further helping in the treatment of addiction to alcohol, cocaine, and nicotine. One cannot overlook the fact that depression, a common co-occurring disorder, usually induces patients to revert back to alcohol consumption. Several studies have consistently shown that both male and female patients who were diagnosed with severe depression before they started the inpatient treatment for alcohol dependence usually began consuming alcohol soon after their treatment. Reports about the interaction between alcohol consumption and weight fluctuation remain inconclusive. Some studies have pointed out no effect, while others demonstrate either drop or gain in weight. Chronic diseases like gastritis, cirrhosis, hepatitis, and pancreatitis have all been associated with excessive alcohol consumption. However, moderate consumption of alcohol has been linked to a few health benefits. According to two national surveys, one conducted in the US and another in Korea, moderate consumption of alcohol was associated with a lower risk of developing metabolic syndrome. Additionally, the US survey reported that mild to moderate alcohol consumption could have a positive influence on lipids, waist circumference, and fasting insulin levels. Moreover, studies reveal that alcohol consumption decreases the risk of developing gallstones. Medium to intense alcohol drinkers, as compared to teetotalers, showed a lower relative risk of gallstone disease. This inverse relationship was noted across various demographic strata, including age, gender, and body mass index. Also, a consistent alcohol intake could further lower this risk when compared to infrequent drinkers. Therefore, despite the many drawbacks associated with alcohol consumption, some health benefits may be associated with moderate and regular drinking. Alcoholic liver disease is a critical issue affecting public health, particularly in the United States, where alcohol-related liver disorders afflict up to 2 million individuals. Common consequences of chronic excessive alcohol intake include fatty liver, cirrhosis, and alcoholic hepatitis. The main treatments for these conditions focus on discontinuing alcohol usage, and for severe cases, may involve liver transplants from donors who abstain from alcohol. Studies are exploring the efficacy of anti-taintives and certain natural remedies like milk thistle and silymarin, both of which show promise. Alarmingly, alcohol is a primary catalyst for liver cancer in the Western world, responsible for 32-45% of all hepatic cancers. It also triggers both acute and chronic pancreatitis, often leading to severe abdominal pain, potential progression to pancreatic cancer, and complications like diabetes and intestinal malabsorption. Nutritional dilemmas often plague chronic drinkers due to decreased food intake, malabsorption, and breakdown of vital proteins, leading to imbalances in skeletal muscle mass and muscle wasting. The dangers of alcohol extend to unborn children as well. The frequency, timing, and amount of maternal alcohol consumption during pregnancy have been linked to numerous dental malformations in children with fetal alcohol syndrome, FAST. These children are at a significantly higher risk of developing complications such as cleft lip and palate, agenesis, maxillary overjet, crowded incisors, anterior open bite, and diastemas. The fetal alterations in the M6 exon and MIS62 genes caused by FAS, believed to be consequential to the teratogenic effects of alcohol, have a significant impact on maxillary fusion processes and odontogenic formation. In addition to alcohol, other maternal behaviors including folate deficiency, smoking, and use of antiepileptic drugs also enhance the risk of oral clefts in infants. Even though there's a lack of correlation between mild to moderate alcohol consumption during pregnancy and oral cleft risk, pregnant mothers should refrain from drinking alcohol, especially during the critical first trimester when a baby's palate and lip develop. Further research is necessary to establish a definitive link between heavy drinking and orofacial cleft in infants. The specific ways alcohol influences the development of oral cancer remain largely unclear. Current research suggests a connection between consuming alcohol and increased levels of estrogen and androgen, particularly in women, which in turn may stimulate a suppressed immune system that can trigger the growth of cancerous cells. Consequently, quitting alcohol can help cut down the risk of oral cancer. Alcohol infused mouthwashes, once quite common, might also contribute to oral and pharyngeal cancer, even though definitive evidence is missing. Acetaldehyde, the body's first product after metabolizing ethanol, may take part in the oral cancer formation, raising when in saliva after imbibing an alcoholic drink or possibly using alcohol-based mouthwashes. There's also a tangible link between alcohol consumption and a heightened risk of periodontitis, a gum disease around the teeth. The risk rises by 0.4s for each 1-day increment in alcohol consumption. Although the specific mechanisms relating the two are ambiguous, it's suggested that alcohol can compromise neutrophil activity, potentially causing bacterial overgrowth and penetration, leading to inflammation and periodontal disease. Notable manifestations being gum recession and loosened teeth likely to fall out if the disease progresses. It's essential to keep track of a patient's alcohol intake to gauge the risk of periodontitis. However, more comprehensive and well-designed longitudinal studies are needed to reinforce these findings. Chronic alcohol consumption can seriously deteriorate vital cellular functions in the lungs, making them more prone to severe complications from lung disease. Recent findings equate alcoholic lung disease to alcohol-related liver disease mortality rates, with alcoholics being more susceptible to acute respiratory distress syndrome, ARDS, and having higher ARDS mortality rates compared to non-alcoholics. Meanwhile, a large-scale prospective study found that moderate alcohol consumption can have a protective effect against respiratory death. Research points out that moderate alcohol consumption might have a protective effect on kidney stones and male erectile function. However, high alcohol consumption can dramatically affect men's sexual behaviors, with both chronic and acute consumption being linked to most studies. Excessive alcohol consumption can lead to serious health issues related to hormonal imbalances. Some theories suggest that alcohol may contain compounds similar to estrogen. In men, these elevated estrogen levels can lead to reduced testicular function and feminization, including the development of male breasts. Gynecomastia. For women, higher levels of estrogen brought on by heavy drinking could increase the risk of breast cancer. A comprehensive analysis examined the relationship between the amount of alcohol consumed and its health effects, using individuals who had never drunk as a reference point. The relationship was found to be U-shaped for both men and women. Compared to those who had never drunk, the protective relative risk, or for type 2 diabetes in men, was highest when consuming 22 g/day of alcohol, but harm began to emerge just over 60 g/day for women. An alcohol intake of 24 g/day was most protective, with harm starting at about 50 g/day. Finding, which demonstrates that moderation could enhance insulin sensitivity in women, is further supported by a systematic review of intervention studies. The manner in which alcohol is consumed, such as whether it is with meals or through binge drinking, also impacts various health outcomes. It's possible that the heightened diabetes risk linked with heavy drinking is due to concentrated drinking on the weekends rather than the same amount spread out over the week. Even though routine alcohol intake is associated with an increased risk of gouty arthritis, it can also decrease the risk of rheumatoid arthritis. The latter point has been demonstrated in 2 recent studies, showing that the more alcohol consumed, the lower the risk of succumbing to rheumatoid arthritis. People who drank regularly had a lower risk, up to 50, of getting the disease compared to those who drank less. Alcohol appears to be protective against rheumatoid arthritis, or those with the condition reduce their drinking post-diagnosis. For postmenopausal women, having more than 14 alcoholic drinks per week was linked to a reduced risk of rheumatoid arthritis. Furthermore, moderate drinking is associated with higher bone mineral density in postmenopausal women and decreases the likelihood of osteoporosis. It holds true for both men and women over 45, albeit with the caveat of the detriments of heavy alcohol consumption, as it is linked to bone loss. Alcohol consumption's effect on health is multidimensional, posing serious risks yet showing surprising protective facets. People riddled with alcohol addiction are observed to be more susceptible to pneumonia, demonstrating a clear negative impact of excessive drinking. On the other hand, moderate consumption of alcohol, 3 or 4 drinks daily, may reduce the risk of contracting colds, though this holds true only for individuals who do not smoke. This differing impact on smokers and non-smokers shows while smoking simultaneously could neutralize alcohol's protective effects, moderate drinking was shown to reduce risks for non-smokers. Interestingly, specific kinds of alcoholic drinks like red wine have also been suggested to provide some resistance against colds, while beer, spirits, and overall alcohol intake didn't show similar effect. However, despite these potential protective effects, alcohol's darker impact cannot be overlooked. The International Agency for Research on Cancer of the World Health Organization in 1988 conclusively identified alcohol as a Group 1 carcinogen. Alcohol's carcinogenic effect was supported by data indicating that worldwide 36% of all cancer cases and 3.5% of all cancer deaths are connected to alcohol consumption. Alcohol has also been linked to particular types of cancers including mouth, pharynx, larynx, oesophagus, and colorectal cancer in men. And pre- and postmenopausal breast cancer in women. Light and moderate alcohol consumption hasn't been spared either, showing increased risk of certain cancers. This cancer link is believed to be heavily tied to acetaldehyde, a product of alcohol metabolism. Individuals with liver disease or certain genetic enzyme deficiencies have heightened acetaldehyde levels, putting heavy drinkers at greater risk of developing specific cancers. Cancer isn't the only serious consequence. Alcohol consumption during pregnancy is of grave concern as well. It can lead to fetal alcohol syndrome, FAS, a condition characterized by birth defects in children whose mothers consumed alcohol during pregnancy. As alcohol crosses the placental barrier, it stunts fetal growth, causes facial deformities, and harms brain structures, possibly leading to physical, mental, or behavioral problems later. Alcohol exposure during fetal development is the leading known cause of intellectual disability in the Western world. The damaging effects on brain insulin and insulin, like growth factor resistance, have also been associated with alcohol consumption during pregnancy. Parental emotional neglect coupled with alcohol abuse significantly contributes to adult relationship problems. Studies show that children of alcoholic parents, particularly those harsh and ineffective in the parenting, struggle with trust issues in adulthood due to fear of abandonment. Moreover, girls raised by alcoholic fathers often find it difficult to interact appropriately with men due to poor modeling of healthy relationships by their parents. On the other hand, boys who grew up in an alcoholic environment often exhibit self-regulation issues, impulse control problems, thrill-seeking behavior, and a low level of frustration tolerance, making them susceptible to early alcohol usage and eventual dependence. The comprehensive economic implications of alcoholism still remain difficult to measure due to variances in methodologies and cost considerations. However, estimates ascertain that alcoholism significantly burdens the economy by introducing direct, indirect, and intangible costs associated with diseases. Excessive alcohol consumption not only degrades health outcomes, but also significantly impacts productivity. A German study in 2016 revealed that the economic cost for alcoholics was 1.5 times that of non-alcoholics, with lost productivity accounting for over half the costs and expenditure on treatment programs forming only 6%. Alarmingly, the economic burden largely fell on individuals between the ages of 30 and 49. In addition, those afflicted with alcoholism often struggle with other mental and physical maladies, further straining healthcare systems, not to mention the individual cost it places on their immune systems, causing complications for those with serious ailments like HIV, pneumonia, and tuberculosis. Alcohol dependence also exhibits substantial indirect costs, with lost productivity and premature death being the main contributors. Lower workforce participation, reduced earnings, and higher rates of absenteeism are common amongst alcoholic men, while female binge drinkers also show increased absenteeism rates. In 2004, alcohol was responsible for 3.8% of global deaths. Alarmingly, for those under 60 years old, this statistic rose to 53%. A startling snapshot of the widespread damage inflicted by alcohol abuse on individuals and society at large.